Hello, today I'll be going over how to assess each of the cranial nerves. So the first nerve on our list is the olfactory nerve, and we usually assess that nerve after any events of trauma. And how we would assess that is we would have various distinct smells such as coffee, soap, or onions, and have the patient smell them with one side of their nostril. So one nostril would be occluded and tested, and then the other as well. The next nerve is the optic nerve, and we will inspect each eye individually, and we will be using a Sneller chart and a pseudo isochromatic chart to inspect for color perception and visual acuity. The next bundle of nerves we will assess is 3, 4, and 6, which is the oculomotor, the abducens nerve, and the trochlear nerve. How we would do this test is having a visual assessment for the patient, and usually we will have a moving object and have them kind of track it with their eyes, and we inspect their eyes for any excessive ocular motion such as nystagmus. The fifth cranial nerve we will assess is the trigeminal nerve, and here we will assess the mandible and other parts of their face. For the face, we will do a pinprick test to test for any sensations, and we will do a cotton swab just around either their lower cornea or the lateral side of the cornea, and just to test their corneal reflexes. The seventh nerve we will be assessing is the facial nerve, and here we will just look for any hemifacial movements. So this can be easily done when you first talk to the patient, look for any abnormalities with their speech, if they are smiling and if there is any asymmetry in their face. And that would be for the seventh nerve. So now number 8 is the auditory nerve. Here we would do a traditional auditory test and vestibular function test. So the next two nerves we will go over is the 9th and 10th nerve, which is the glossopharyngeal and the vagus nerve. Here we will have the patient perform kind of an ah sound with their mouth, and when they go ah, we look in their mouth to see if there's any asymmetry in any aspects of the mouth, such as their palate or their uvula. And we would also assess their gag reflex to see if there's any imbalances with either side. If it was a bilateral response, that would be normal. The next nerve we will be going over is the 11th nerve, which is the spinal accessory nerve. Here we would just do manual muscle testing for the SCMs and the traps. The next one is the 12th nerve, which is the hypoglossal nerve. And here we just do a tongue inspection to see if there's any atrophy or weakness with their tongue. And that was the cranial nerve assessments. Thank you.